Let's look at the IVF data. Patient numbers up to around 55,000 IVF or donor insemination, up from 53,000 in 2019. If you look at treatment cycles, total IVF and donor insemination cycles increased by 10% from 2019 to 2021. Let's look at the IVF cycles, and they rose to 76,000 in 2021 from nearly 70,000 in 2019, an increase of 9%. If you look at donor insemination cycles, they increased to 7,000 in 2021 from around 6,000 in 2019, a 22% increase. Let's look at the pregnancy rates. And the pregnancy rates with IVF using fresh embryo transfers of patient ages between 18 and 34 were 41% per embryo transferred. Birth rates, that's again the preliminary IVF birth rates using fresh embryos from 18 to 34, the national data shows was 33% per embryo transferred. If you look at patients aged 43 to 50, so very few over 45, the rate was 4% using their own eggs. Birth rates were typically 3 percentage points lower than pregnancy rates, and this is the difference between clinical and non-clinical pregnancy rates. Now, if you go to frozen embryo transfers, the average IVF pregnancy rate was 36% per embryo transferred, and the birth rate was 27% per embryo transferred. Let's look at the national data on multiple pregnancy rates. In the UK, average of multiple pregnancy rate reached a low of 5% in 2021, down from the huge 28% in 1990s. Let's look at the egg storage cycles, and these increased in rate from 2,500 in 2019 to 4,200 in 2021, an increase of 64%. If you look at embryo storage cycles, these also increased to about 8,300 in 2019 to 10,700 in 2021, a 30% increase. The average age of the patient coming up for IVF was around 36 years average, and the average age of those coming up for donor insemination was 34 years. The overall average childbirth rate in England and Wales has increased to 30.9 years. Single and same-sex patients increased the use of IVF and donor insemination from 2019 to 2021 and was the largest increase seen in IVF usage. Then we come to funding, and we come to private as well as NHS, and private funding increased with 63% of IVF funded privately compared to 52% in 2019. When you look at NHS funded IVF cycles, they decreased to 20,000 in 2021 to around 24,000 in 2019, seeing a dramatic decline to NHS funding in IVF by 16%. So this is in short the trends that we see in the national data.